Good afternoon, everybody. Thank you for joining us today. Apologies for the couple-minute late start. We are here today in the Health and Social Services Subcommittee of Appropriations to hear from the Department of Aging and the Department of Human Services on their overview of their budget for FY26. So we will start with Department of Aging first, but ma'am, we're going to have DLS come first to the table to do their analysis, and then we'll do questions, and then we'll go to you, Madam Secretary. So when you're ready. Thank you.
Thank you, Madam Chair and members of the committee. My name is Victoria Martinez, and I'm with the Department of Legislative Services. So today I'm going to talk about the Maryland Department of Aging budget analysis. The Maryland Department of Aging functions as the federally designated state unit on aging and receives both federal and state funding that is distributed to 19 local area agencies on aging, who provide services to older adults such as information and referral services, meal delivery services, and assisted living subsidies. Starting on the first page of the analysis, the fiscal 2026 budget decreases by $869,000, or about 1%, to $90.3 million. The fiscal 2026 allowance includes one deficiency that totals to a $1.5 million increase in the fiscal 2025 appropriation to provide funding for several programs. Moving on to the overview of agency spending with Exhibit 1 on page 4. This exhibit shows an overview of the agency spending for fiscal 2026 allowance. The majority of the budget goes towards various state and federal funded programs. The two largest shares include various federally funded programs through the Older Americans Act that accounts for 28% of spending, and the state-funded senior care program, which accounts for 15% of agency spending. Moving on to the proposed budget change, Exhibit 2 on the following page shows what is driving the change in the budget. The two largest decreases were $913,000 due to the expiration of ARPA stimulus funding and a decrease of $682,000 in the senior care program. This exhibit also shows various other changes in the fiscal 2026 allowance, including changes relating to funding to local AAAs, new initiatives, and programmatic and administrative changes. Exhibit 3 on page 7 shows the various community services programs that are funded by MDOA and mainly administered by the AAAs. The vast majority of programs were level funded and showed no change in funding in fiscal 2026. In terms of personnel, with the discussion on page 9, the fiscal 2026 allowance includes one new position for information technology support and 6 contractual conversions, which provides for a total of 56 regular positions and 3 contractual positions. Moving on to the discussion of the key observations on page 10. The first key observation discusses a departmental bill that would consolidate 3 of MDOA's community programs, including senior care, senior assisted living subsidy, and the congregate housing services program to facilitate managing the programs as one singular program to make them more flexible and accessible. These programs provide financial support and case management to older adults to allow them to live independently for as long as possible and to avoid costly stays in nursing facilities. The second key observation, beginning on page 11, is on the senior care program waitlist and participation. So if you turn to Exhibit 4 on page 12, this exhibit shows the senior care participation and waitlist size from fiscal 2022 to 2024. In fiscal 2024, The waitlist continued to increase while participation in the program decreased. Exhibit 5 shows, on the next page, shows both participation and waitlist in the program by jurisdiction. Those with the highest waitlist include Baltimore City, Frederick, Wicomico, and Charles. And for each of these, the number of individuals on the waitlist was larger than the number of participants in the program. Exhibit 6 on page 14 is a similar chart that's broken down by jurisdiction, but shows the change in participation and waitlist from fiscal 2023 to 2024. As you can see, the number of participants decreased in all jurisdictions. DLS has asked that MDOA explain why participation in the senior care program in fiscal 2024 decreased while the waitlist continued to increase, and to also discuss efforts to efficiently enroll individuals from the waitlist into newly open slots. In terms of funding of the senior care program, $8.5 million was added by the General Assembly in fiscal 2024 to address the growing waitlist, but there have been challenges with spending the increased level of funding. Exhibit 8 on page 15 shows the funding for the program. MDOA reverted about $5.9 million of senior care funds at fiscal 2024 closeout, resulting in actual spending of $8.7 million. The program is funded at a much higher level of $13.9 million in fiscal 2025 and $13.2 million in fiscal 2026. MDOA and AAAs reported various challenges in spending the funding in fiscal 2024, including unclear guidelines since the increased funding was not planned, and administrative barriers such as lengthy processes for authorizing spending. Due to the fiscal 2025 working appropriation reflecting a level of funding more than $4 million beyond actual fiscal 2024 spending, DLS recommends reducing $2.5 million for the program to better reflect actual spending in recent years. This reduction would allow for a more gradual increase in funding from the $8.7 million spent in 2024 to $13.2 million in the fiscal 2026 allowance. Moving on to the third key observation, beginning on page 16. This key observation provides an update on two recently created initiatives. The first is the Long-Term Care and Dementia Care Navigation Program that was established by legislation in 2023 and provides support to persons living with dementia. In terms of funding, there is a $2.4 million mandate for the program, but this amount was reduced by $1.2 million in fiscal 2025 by the Board of Public Works. The fiscal 2026 budget includes a reduction of $1.2 million for the mandate that is contingent on the passage of the Budget Reconciliation and Financing Act of 2025. Regarding the implementation of the program, MDOA submitted an annual report which discussed the program's vision, goals, structure, and organization. Exhibit 8 on page 18 lists the 7 established goals and the department's progress towards these goals. The second initiative is the Longevity Ready Maryland initiative that was established by executive order in January 2024 and requires MDOA to develop a multi-sector plan to guide systems transformation over the next 10 years. The department plans to share the final plan and recommendations with the governor and the General Assembly in July 2025. The discussion on page 19 summarizes some of the activities related to this initiative. Some activities that I'll highlight include the formation of work groups to address priority areas and the data dashboard that has been in the works and is set to launch a final version in July 2025. The last key observation that I'll discuss on page 20 is related to the Task Force on Preventing and Countering Elder Abuse. As required by legislation in 2023, MDOA established a task force to conduct a review of issues relating to abuse, vulnerability, and exploitation of the older adult population in Maryland. The task force submitted a final report with its findings and recommendations in December 2024. These recommendations are summarized in Exhibit 9, that's on page 21, and DLS has asked MDOA to discuss their plans to implement these recommendations. And with that, I'll conclude my presentation, and I'm happy to take any questions.
Thank you, Ms. Martinez, for your thorough analysis. Do any members of the subcommittee have any questions? Seeing none, thank you so much. We'll now call upon Madam Secretary to join us at the table, Secretary Roque, and anyone from your team you wish to invite may join, and you can begin whenever you're ready. Thank you. And welcome back to HSS.
Thank you. Good afternoon, Chair Shetty and Vice Chair Jones. It is really a pleasure to be back here and to be able to talk to you about our budget. I think some of you know I consider a budget a moral document, and this reflects our values now, caring for the people of Maryland, and into the future. I'm Carmel Roque, Secretary of the Department on Aging. Our fiscal year 2026 budget reflects both the challenges and the opportunities of serving Maryland's aging population today and significant work towards building a sustainable, cost-effective network of services and supports for the future. It reflects the ongoing work of reaching our aspirational goal of all older Marylanders leading lives that are healthy, fiscally secure, socially connected, and purposeful across the full life course, which we know now includes 100 years. We believe that these are both aspirational goals, but that they express the values of the state of Maryland and its care for older people. The work of our agency falls into two functional but interrelated areas. First is grants administration for all of the federal funding and state funding that flows directly to the agency. I will raise at this point that most of the funding that actually serves older people in Maryland does not flow through the Department on Aging. And that's one of the reasons why we are working so very closely with our sister agencies and working on our multi-sector plan. This is not something the Department on Aging will be able to do on its own. The second functional area is in the area of planning, policy, legislation, and advocacy. And historically, the department has not been as active as we are now in this area, and we plan to continue to be. Over the past year, we've made progress building our agency's capacity to meet our mission by recruiting and hiring experienced staff to serve in key positions. Today, we have 3 vacant positions that are currently not assigned to a planned contractual conversion. We started 2 years ago with a 30% vacancy rate. And this year, we've worked very, very hard to fill those vacancies. It's taken longer than any of us would have wanted it to. We've had multiple phases of trying to recruit and retain employees, but I think we finally are where we want to be. I'm incredibly proud of my staff. Bolstered by some of our new in-house hires and outside technical assistance, we've conducted program and fiscal analysis across all of our programs, as well as extensive stakeholder engagement so we can best determine where what we're doing is working and where we need further improvement. As a result of that engagement and data assessment, we have 2 department bills that were introduced this year to modernize 4 state-funded programs designed to support older adults in their homes. In short, the shared goal of both the bills is to modernize 4 significant state-funded programs for older adults living in their homes and to be able to serve more older adults with expanded services and the same amount of funds. MDOA has also seen our competitive grant-seeking opportunities pay off significantly this year for the benefit of the Aging Network and growing, promising, evidence-based models and interventions that support older people. We receive federal funds in partnership with sister agencies and the Aging Network partners to expand our capacity around caregiving, housing unhoused people, and also the Capable program, which is community aging in place. Bringing together the right partners and supporting the growth of these kinds of models and interventions, once they are shown to be effective, could lead to additional state-supported growth of these interventions in the future in partnership with the Aging Network. I'll note that we've been very busy leading stakeholder engagement and are in the drafting stage of the Longevity Ready Maryland Plan, which will issue its final report to the governor and the General Assembly in July of '25, and it will drive our legislative and policy-focused work with partners for at least the next 10 years. Finally, we're all aware of the state's budget climate, and much of our department's work this year has been directly responsive to those challenges, focused on achieving greater efficiency with our existing state funding. We want to be able to stretch the existing funds we have to better serve older Marylanders with useful services when and where they need them. The cuts we absorbed this year through the governor's reductions during the summer through the Board of Public Works and what you all see reflected in our proposed fiscal year 2026 budget represent reasonable adjustments to our newest programs and where the reduction would be least impactful to ongoing services for older adults in their homes. DLS's additional proposed $2.5 million cut to the senior care program in fiscal year 2025 would be very destabilizing. It would reduce staffing and direct service availability for older adults living in their homes statewide. At the Area Agency on Aging level, these fiscal year 2025 senior care funds have already been fully planned for to spend down on services and staffing. I respectfully urge you to reject this proposed cut. These state funds are more critical than ever in our current federal funding climate. All of the Older Americans Act funding from the federal government is at risk. And at this time, we are still waiting for guidance from the administration on community living as to what that will actually mean for us. These are essential services, such as ensuring that older people do not go hungry, transportation to doctor's offices, to shopping, for social connection, and in-home care services for those who are seriously compromised. For example, our federal nutrition dollars provided 3 million meals to older people in fiscal year 2024. In closing, I'm confident that in partnership with you, we can work our way out of this year's budget challenges and move forward in an efficient way that preserves the department's ability to support, advocate, and plan for older Marylanders. Thank you very much.
Thank you so much, Madam Secretary. I see another light. Do you want to add to her testimony, or are you available for questions?
I think at this point it might be helpful if our CFO responds to some of the DLS analysis.
Oh, thank you, ma'am. Sorry, I apologize if I missed that. Yes, of course, you're welcome to do so. Thank you and welcome.
Thank you. Good afternoon, Chair, Vice Chair, distinguished members.
Could you please move the microphone a little closer?
Sorry about that. Good afternoon, Chair, Vice Chair, and distinguished members of the subcommittee. We come before you today to advocate for the Department of Aging's budget, which sustains the programs that protect and support one of our state's most valuable assets, our older adults, along with their family caregivers and the service providers who care for them. MDOA is a relatively small agency with an outsized impact. The department leverages approximately $40 million in state general funds to secure an additional $50 million, primarily federal funding, including OA grants, discretionary grants, and in recent years, ARP grants, nearly all of which are projected to be expended by their expiration date, September 2025. Of the $40 million in state funds awarded to MDOA, only $4.4 million, just over 10%, is allocated to operational costs, primarily covering salaries and fringe benefits for a small but dedicated workforce. This includes our programmatic and policy personnel, operational team, and fiscal staff who ensure that programs are effective, fiscally compliant, and aligned with the administration's policy objectives. Beyond a few essential line items that keep the lights on, we have no excess or discretionary funding available to absorb additional budget reductions. The proposed MDOA FY26 general fund budget of $39.6 million reflects a net reduction of $600,000 from FY25. There is a $770,000 increase in personnel funding, which is attributed to the new IT director position, which is going to modernize data collection, enhancing program effectiveness and compliance. We had competitive hiring efforts in FY25, which, as the secretary mentioned, successfully reduced our historically high vacancy rate from nearly 30% to just 3 unfilled positions when excluding those slated for contractual conversions. And we also have structural salary increases implemented in FY25. The 6 contractual conversions will be mostly budget neutral, funded through federal resources or self-sustaining state programs. However, our budget reflects a net reduction from FY25 to FY26, primarily due to a nearly $700,000 decrease in funding for the senior care program and the elimination of several smaller state grants. At MDOA, we operate under the mantra that we can do more with less, but only to a point. This FY26 cut in senior care spread across 19 AAAs is manageable. However, the proposal to cut an additional $2.5 million in the program in the current fiscal year would be potentially devastating. AAAs have already made hiring decisions and programmatic investments on the basis of the allocated funding levels. Moreover, during our mid-year fiscal reviews with the AAA network, we have consistently heard that senior care funds are being fully utilized and that additional funding will allow them to serve more individuals. Any savings the state might achieve from reducing this program in 25 would come at the direct expense of the low-income beneficiaries who rely on this critical support. The deliberation of our budget occurs against the backdrop of some serious fiscal challenges facing MDOA, which I'll outline briefly. Expiration of ARPA funds. Since FY22, MDOA has benefited from a substantial influx of ARPA dollars, including significant administrative funds that help navigate funding shortfalls on the state side. These funds will expire in September 2025, leaving MDOA without this crucial funding cushion. We also have had flat funding federal resources. Federal funding has remained constant in recent years, presenting operational challenges for MDOA. The agency must fund structural salary increases despite federal funding remaining the same. While the state mandates COLAs, steps, and other salary adjustments, these increases are not supported for federally funded positions. CCRC program deficit, we have in the continuing care retiring communities. Certification fees for the special fund program were reduced by the previous administration in 2016 from $28 per unit to $25. Since 2018, the CCRC fund balance has declined from $880,000 to where we've reached the point that without significant intervention, this program will no longer be self-sustaining and is projected to run a deficit in FY25, further straining our general fund budget. To address this, MDOA has proposed a fee increase, which will generate nearly $70,000 additional revenue, but state funding may be necessary to keep the program solvent. And finally, we have fiscal uncertainty due to the new federal administration. Recent tumultuous events have underscored the uncertainty surrounding the new administration's approach, particularly with regards to the level and timing of federal grant funding. Now more than ever, it is crucial that our AAAs have the confidence and assurance of consistent state funding support. MDOA is fully aware of the current fiscal challenges facing the state, and we incorporate these considerations into our budget planning, salary structures, and ongoing efforts to secure new grants and funding opportunities to alleviate pressure on state finances. At the same time, we ask the legislature to recognize that despite a relatively small general funds budget, the department delivered significant tangible outcomes for older Marylanders. We respectfully urge the legislature to preserve our funding and avoid reductions that could undermine these essential services.
Okay, thank you. Appreciate the responses to the DLS analysis, and thank you for your testimony. If there's nothing further, then we will begin questions from our subcommittee members. So who has some questions? I see Madam Vice Chair.
Good afternoon. Thank you so much, Chair, and thank you all for being here. Let's jump in. So I'd like to flip to DLS report 16, page 16, towards the bottom. This is in regard to dementia care for funding. It mentions that BPW approved a reduction of the general funds for dementia care navigation program by $1.2 million. The 25 BRFA has reduced the mandate amount for FY25. Could you all describe how this program is going to be impacted by the fund reductions and what your department is still able to do with its current funding amount?
I think I would like to ask Deputy Secretary Crowley to talk about that.
Great. Thank you so very much.
Hi, good afternoon. Basically, with those reductions, what we determined is that because we were continuing to plan for the implementation of beginning the new grants, as well as an overall training and education initiative for both providers and also outreach for caregivers and people living with dementia. We were in that planning process. We have a full-time staff member who is working on the implementation program. We had to pull back some of our grant awards that were made to the AAAs following that reduction, and have just shifted some of the priorities. And hopefully are just simply delayed. But what we have been able to do is really partner with a number of universities and around research efforts, ensuring outreach. We do know here in Maryland that Prince George's County and also Baltimore City have the highest rates of dementia and Alzheimer's disease and dementia and related dementias. So it's of great concern, but we are continuing that outreach.
They have the highest, you said they have the highest rate. Do you mean
highest rates? So top 4 communities, jurisdictions in the country, Baltimore City and Prince George's County are noted as 2 of those top 4. I believe Prince George's County is the second highest rate.
Well, thank you so very much.
Thank you, Madam Vice Chair. Thank you, Department. Delegate McCaskill.
Madam Chair, appreciate it. Thank you all for being here. I have questions around the senior care waitlist data. I'm specifically referring to, I'm looking at 13 Exhibit 5. Well, Exhibit 4 and 5, so I have a few questions around that. In your written testimony and the DLS analysis, I'd like to make sure that I'm understanding what's happening there. Okay, so in each of the jurisdictions. And so you mentioned in your testimony that the data reporting and management has been inconsistent. What are the improved processes that, let me reword that. What are the improved processes you mentioned, and when did they go into effect?
I'll just give you a little smidgen of an answer, and then I think that we're going to have Eloise, who's really the person who understands our grants administration the best, talk specifically about the data. One of the reasons why we did significant stakeholder engagement and worked with our AAAs during the course of this year around the bills that we've proposed to modernize the senior care program, the congregate housing, and the senior assisted living program are related to this issue of inconsistent data collection. The eligibility criteria, the service package, And the way the data is collected in terms of people served or unit of service or contact, it varies tremendously across the state. And so the work that we've done so far is the stakeholder engagement to say, where are the pain points? What's not working well here? Implementing the move toward getting this legislation passed. And then there will be further work to develop regulations, et cetera, that's going to standardize some of that. But for right now, I'll let Eloise talk a little bit about the contact that we have with our area agencies on aging and other fundies to try and improve it.
Good afternoon. So to speak a little bit about the senior care program and the processes that we have undergone within the last year to ensure that we are doing better with tracking and having our local AAAs understand how to actually track their data is one, for a whole year, we were out a senior care program manager. So as we received reports, not knowing what the AAAs were actually putting into their annual reports made a difference in what we were seeing. So now that issue has been fixed. We have a program manager in place, and there will be consistency in AAA's understanding where the primary two categories for data reporting is, and that's in our gap filling and case management services within the senior care program. Within the last 2 fiscal years, we have worked with our AAAs mid-year. We do a mid-year assessment now. We're following up with our AAAs to ensure that after the first 2 quarters, we get an idea where our AAAs are as far as spending and tracking, and also ensuring that they are on point for spending at the end of the year. So there are a lot of things that have been put in place to really improve the quality of service delivery, as well as on the administrative side, improve the efficiencies in delivering the services throughout the state.
Thank you. That's good to hear. Madam Chair, could I take one more? Thank you. I appreciate it. So I'm looking at the Exhibit 5 on this question, particularly for Baltimore City, but we also, if you could, speak maybe on Frederick County as well, because it's the same dynamic. We continue to have experience larger wait lists, but fewer participating Marylanders. Can you see on the chart I'm talking? Okay, good. Yes. Could you explain what's happening in those jurisdictions?
Specifically for Frederick County, during the fiscal year in which we did receive waitlist funding, they implemented a new program that would allow them to reach out and determine what individuals would need ongoing and long-term care services. Prior to us having those waitlist dollars, they were not taking those individuals into consideration. So once we had those extra dollars, their wait list grew by almost 1,000 people. So that's where you see that increase in individuals being served, individuals sitting on the wait list for Frederick County. For Baltimore City, it's my understanding that their wait list continues to grow because there is an issue with staffing, getting case managers on board, and actually looking at those individuals that need case management services versus just one-time only gap filling services or short-term services.
Okay, so let me just understand real quickly. Thank you for that. So the wait list is not necessarily folks that's calling for the agency for inquiry. Those are folks that are literally like already in.
They have been screened. They have had level 1 screens, and they're either waiting for mainly a case manager.
Okay. Okay. Thank you, Madam Chair. Thank you for that.
Thank you, Delegate. Thank you so much. for the response. Do we have other questions from subcommittee members? Delegate Ruff?
Thank you, Madam. Excuse me. Thank you, Madam Chair. First, I wanted to follow up on my colleague, Delegate McCaskill's question about the staffing and case management voids in Baltimore City. Can you extrapolate a little bit more about why those voids exist and if this budget addresses how to bridge those voids for the elders, those wise folks in Baltimore City that absolutely need this senior care management?
I want to just, for the record, make sure that it's understood. This is Eloise Main, who is our Assistant Secretary for Grants Administration. So to this question, you went right to the heart of the matter.
I tried to.
All of us in the sector that provides care and services for older people, but for others as well, have struggled with the ability to recruit and retain staff. And this was already happening prior to COVID. COVID really put a big hole in the boat, and we have yet to begin to recover. This is not unique to Maryland or to certain jurisdictions in Maryland. This is a national crisis. I don't want to quote the actual numbers, but when I'm on the Governor's Workforce Development Board and the Labor Department reports what the vacancies are for frontline care workers, nurses, doctors, you name it, it's staggering. And so this is really that issue, which is being able to make sure that not only do we have the people to do the screening and arranging for the care management, but then the people to actually provide the care. And that's something where we address in the Longevity Ready Maryland plan, actually, and it's why our agency is working so closely with the Labor Department here in Maryland, because without qualified staff and numbers that can actually meet the need, this is going to just get worse and worse.
Okay, yeah, I think I would love to hear more specific details about strategies that are going to avoid that gap. I'm Delegate McCaskill's from 21215, where I grew up, and we would definitely want to see that addressed. Can we go to the vacancies within your department? You requesting the new allowance for the IT position, and I understand the modernization impetus there. But then we look at the vacancies on page 9, where you reference the term of these vacancies. And I'm wondering first, I know you maybe provided an update in your oral testimony today from the end of December. Are there vacancies that have been filled since this written report was provided?
Yes.
Okay, that's good.
We had 7 new staff people come on in a very short period of time.
That's very good.
And I want to say, it wasn't like we waited till the very end. We have been working tirelessly on staffing up. And there are many things that have complicated that, as you can well imagine. A lot of it had to do with being able to provide competitive salaries in a market that is extraordinarily tight. And then some of it really just had to do with finding the right people to do this work. And I think it's been well worth the effort that actually all of our staff have put into this, because there are panels that interview and those kinds of things. We've also done a lot of work around agency culture, so that people want to work with our department and feel really connected to the purpose of our work. And we're finding that we just have this really great team of people on board now. So it's been a long journey. I am hoping that we can hold on to all of them. We certainly have things in place to try and do that.
Very good. So where does your vacancy percentage fall now? Since it was 30, you said when you started.
Yeah.
What's the progress?
I don't know how exactly to say that in terms of percentage.
I didn't either. That's why I asked you guys.
I just go with okay. So I don't know, Michael, do you have a way?
6-7% is really.
We currently, most accurately, we only have 3 vacancies out of 49 positions, because even though technically there are 7, but 4 of those vacancies are slated for people who are already currently work in the agency in a contractual capacity, and we had conversions to permanent PINs approved in the FY25 budget, and we're going to be moving them in. So in terms of true vacancies that we would be hiring for, there are only 3 out of 49.
Got it. And so other than the salary increase idea, are there other strategies, or are you guys still kind of strategizing around the need to fill the vacancies?
I see Deputy Secretary Crowley going, let me answer that one.
Yes, you read my signs very well. Thank you. We've employed a number of strategies, really outreaching to national organizations, again, trying to find the right people for the right seats at the right time. So we also are employing social media for recruitment possibilities, a lot of work around agency culture. And then the other piece that has been really important, and as we're looking at modernizing our agency and the evolution, and really about preparing for serving a much larger aging population and a more complex population, if I may say. What we have done is really gone through job descriptions, position descriptions, even looking at the positions with a very fine-tooth comb, and recognizing and looking at what kinds of qualifications and skills are essential to doing the work of the Department of Aging. And so that has been an incredible process, as you can imagine. You know, it's internal, and then it goes external to our human resources. And then after that, we get the position better or right to what we believe meets our needs and meets the needs of Marylanders, then we begin that recruitment. And I will also just add that it's not just been one recruitment effort. I can, off the top of my head, I can think of one position in particular that we had to lead at least 3 recruitment efforts to fill that position. I will say, it is worth it for the person who we were able to successfully recruit into that position. And there's going to be tremendous added value because of that effort. But in the meantime, we were shifting a lot of different resources to continue to ensure that the work was continuing.
Thank you. And Madam Chair, if I might just add one comment, I really appreciate Delegate Jones, your comments about the dementia care and the funding levels there. My father unfortunately passed away from dementia in 2022, and he's just one of the many Baltimore City residents that have suffered from such a terrible disease. And I appreciate your efforts working for trying to mitigate that, working to eradicate it, and thank you very much for that service.
Thank you.
Thank you so much, Delegate. Thank you to the department. I'm going to go to Delegate Heinbaugh, and then I see your mic was on again. Did you have a second bite?
Madam Chair, I think I may have answered my own question.
Okay, thank you, ma'am. All right, so Delegate Heinbaugh.
Thank you, Madam Chair. I'll be quick. Well, let me begin by just thanking you all for what you do for senior citizens. I'm getting up there, so I can appreciate that more maybe than I used to. I also want to applaud the initiatives that you've undertaken to allow seniors to stay at home. I think that's not only compassionate, but having some experience in putting people in nursing, it's got to be more cost effective than putting people in a nursing home. So I would just say the more that you can do, the better. And my question is about the senior care program. In the DLS analysis on page 2, it points out that you had a reversion of FY24 funds of, I think it was $5.9 million. And it says one of the reasons that there was a reversion is that the area agencies on aging didn't have confidence that that money was going to be a multi-year. So do you agree with that?
I absolutely agree with that. It was funding that was one time only in our understanding, and it was specific to the wait list. We went back and got some further guidance that let us have a little more flexibility and not have to only spend it on the wait list. But the area agencies were very reluctant to staff up and begin to serve people when they had no idea whether that money was going to be there again the following year.
So was that was the predominant reason, I guess, then, the major reason? Were there other reasons, or was it staffing? Or
I think that was part of it. I don't know if staff here have other things they want to add to that.
Yeah, I can add to it. Because it was unexpected money, and as the budgeting committee, I think you'll understand this, that our AAAs required spending authority to be able to ultimately use those additional dollars. And we have 19 jurisdictions. We have 19 different ways that those jurisdictions require spending authority to then be able to utilize those dollars. The other piece to that is that while we have 19 different ways of doing it, that means that there's also 19 different timelines. And so depending on, which jurisdiction, the funds were in, that then dictated how quickly the AAAs would be able to access those dollars. And additionally, just to reiterate, it was a very challenging situation from the perspective of how do we give someone services and then take those away. And so it was operationally a tricky situation. The funds were most welcomed, but then getting those to the people who needed them most. And I will say that in FY25, we successfully worked with our partners at the Department of Budget and Management when we received the additional $4 million, and we were able to have those dollars that were added and into that senior care budget without restrictions to be spent solely on the wait list. And our thought behind that was that will ease the administrative burdens for the AAAs and ultimately, be able to spend appropriately.
Okay, thank you. Just one other question. And under this program in FY25, I think you spent $8.7 million, and in FY26, there's going to be $13.9 million. So, do you have a high degree of confidence that you're going to be able to use the additional money effectively, be able to spend it?
I do have a high degree of confidence, and a lot of it is because of the sort of safeguards we've put in place at the department level. We also now have a program monitor position filled, and we have a fiscal auditor position filled, and we have several director positions which oversee these programs filled, and that level of both guidance and monitoring of our fundees is absolutely going to make a difference. And we already have had conversations where we have reasons to believe fiscal 25 is spent. The dollars are already accounted for. So the need is growing. The numbers of people who need these kinds of resources is growing. So I don't think there'll be any unmet. I don't think the issue is that there won't be people who need the resources. And I think that we are becoming more effective in our ability to assist our grantees in actually spending these resources appropriately. And our new legislation is going to provide additional flexibility and opportunity to just continue to make this program much more effective and efficient. So I'm feeling very confident about it.
Thank you. Thank you, Madam Chair.
Thank you so much, Delegate. Thank you, Madam Secretary. I have a question about the senior care participation rates. I might follow up with you by email, but the gist of it is I just want to understand the participation decrease in the program, especially identified in Exhibits 5 and 6 on pages 13 and 14. So I'm going to follow up by email with the detailed question and copy our DLS analyst as well, just so I can get a better understanding of that. Are there other members of the subcommittee that have questions? Okay, seeing none, thank you so much, Department, for your responses. We appreciate it. I would ask, if you can, to please stick around for just a few more minutes. The next panel, we have three individuals signed up to testify, and I would love for you to hear them if that's possible.
Thank you very much.
Thank you. Thank you. So calling up now, we have three witnesses signed up to provide favorable and favorable with amendment testimony. So I'm going to ask all three to please come forward. Carol Leinhard with the Maryland Senior Citizens Action Network, favorable. Megan Peters, Alzheimer's Association, favorable with amendment. And the Maryland Association of Area Agencies on Aging and SECO, favorable with amendment. You can go in any order you want. Whoever wants to go first, we'll do all of your testimony and then an opportunity for members to ask questions. What is the time limit again? Okay. 2 minutes, please, per advocate. Thank you.
Good afternoon, Chair Shetty, Vice Chair Jones, members of the committee. My name is Megan Peters, and I'm the Director of Government Affairs for the Alzheimer's Association. Dementia, as you all have mentioned today, is a growing public health concern in Maryland. We know there's high prevalence, we know the cost of care is significant, and dementia takes a devastating toll on caregivers. The programs and services offered through the Department of Aging are vital to meeting the needs of our older adults, including those living with dementia, and I thank the committee's support over the years for funding these critical services. We recognize the state's budget climate and uncertainty surrounding federal funding, and as we look into this future, it's important to continue to invest in programs for older adults because they can lead to these long-term savings. As introduced, the governor's budget protects the majority of funds for existing department services, except one key program that's been mentioned earlier in the briefing, the Dementia Care Navigation Program. Today, I'm urging you to protect and restore this funding as it is at risk of permanently being cut in half. The program was enacted in 2023 and has a mandatory appropriation of $2.4 million each year, and the Budget Reconciliation Act, as introduced, includes language to reduce that appropriation to $1.2 million each year. While the governor did cut current fiscal year funding for this program in July, it would be devastating to continue that into the future. This program helps our caregivers navigate the complexity of dementia care, and care navigation has been shown to reduce healthcare costs and improve quality of life. If we don't address this issue, we know the strain on Medicaid will increase. In 2020, Maryland Medicaid costs for caring for people with Alzheimer's was $1.2 billion, and the average per person Medicaid spending for people living with dementia is 22 times greater than that of people without. If you or someone you know cares for a loved one with dementia, you understand how significant a diagnosis is. Care navigation allows for coordination and reduced strain on our caregivers and healthcare system. This program will benefit the state in the long term, and I urge the committee to protect its funding. Thank you.
Nicely done, staying right within the time period. Thank you. I took a little jump when that went off. So. Thank you so much. Thank you. Next.
Thank you, Madam Chair. Members of the committee, I'm Ann Seacott, and I am testifying this afternoon on behalf of the local area agencies on aging, the AAAs that serve your communities, your constituents. So I want to echo what Ms. Peters just talked about with the cut to dementia care. That is something that certainly impacts the AAAs and their ability to meet the requirements of the program. And for some jurisdictions, it's about starting up the program, and for other jurisdictions, it's about expanding existing services. So that cut absolutely hurts. My main point for being here today is to oppose the recommendation to cut $2.5 million from the senior care program. I very much appreciate the question, Delegate Heinbaugh, that you had just asked, and the discussion with the department about the problems with that, why it appears as though the AAAs are not able to spend the money. It was unplanned dollars that we are grateful for the General Assembly making happen that extra $4 million or $8 million. So it was unplanned. It was one time only. These AAAs were loath to enroll people in services without knowing that they would be able to continue. They did not want to hire people to provide the case management services if they weren't going to be able to continue to keep those folks employed. It is absolutely essential when you look at the growing wait list, when you look at the growing aging population. These are services that keep people out of nursing homes, as you've pointed out. And so we have absolute confidence that they will be able to spend the money that's been allocated. They spent 98% of the funds that were the base funds that had been allocated. Knowing that these dollars are going to be ongoing, they will ramp up what the services that they need to do, enroll the people, and hire the staff. I would be neglectful not to recognize we have several AAAs sitting here in the audience with us today. If folks have, want to talk afterwards.
Thank you so much. Would they like to just stand and wave or something?
Sure. We've got folks from Baltimore County and Harford County and Howard County today.
Thank you so much. Thank you for doing the work that you do. Thank you so much, Ms. Zico. Next, please.
Were you done?
Yes.
Okay, good afternoon. My name is Carol Leinhardt, and I am the retired director of the Harford County Office on Aging. I'm a past president of the Maryland Association of Area Agencies on Aging, and currently I serve as the co-chair of the Maryland Senior Citizens Action Network. I'm 80 years old. So I've been around a long time. I've been in the Aging Network for a long time, and I've been coming down here every year for a long time to talk about the value of the work of the offices on aging. And I know that all of you hear from your constituents and lots of complaints about how much it costs to provide services to older people, to provide services to your constituents. But what we can prove in the Aging Network over and over again is how much money we can save if these programs that are designed to help older people stay in their homes are fully funded. I'm going to give you a key number. I get the key number every year. How much is nursing home cost in the state of Maryland per year now? It's $133,502 a year, which is about $11,000 a month. And a number of these programs are designed to keep people out of those nursing homes. The Congregate Housing Services Program, for example, is $3,000 a year to keep someone independent in their apartment in Maryland. So if you look at that, we can serve almost 4 people for the cost of 1 month for one person in a nursing home. So these programs are tremendously cost effective. Senior care, you all have been studying and looking at that program. We've looked, and I've been coming down here for years. The senior care wait list is usually around 2,000 people. It was 1,999 in 2024. That waiting list normally has about, is that my time? Mm-hmm. All right. I'm going to just end by saying, appreciate the opportunity to be here, to ask you to preserve the funding for the Department of Aging and all of its many programs, and to thank the area agencies on aging for all of the work that they do for all of your constituents. And thank you for your attention.
Thank you so much for all of your testimony. Are there members of the subcommittee that have questions? Seeing none, I just want to thank you all for your written and oral testimony, and most importantly, for the work that you do every day. So thank you so much.
Thank you.
Okay, that concludes our budget hearing on the Department of Aging, and we'll now turn to the Department of Human Services overview. budget. We are going to be, we'll start with our DLS analysis. I've got, looks like a couple joining to the table. So once you settle in, you can begin as you wish. And after that, we will hear from Principal Deputy Secretary Carnitra White from DHS. Thank you.
Thank you, Madam Chair. I am Suviksha Bujel, and we are here to present the Department of Human Services budget overview. Before I get started, I would like to request my fellow DHS analysts to introduce themselves.
Tanya Zimmerman. I'm here in my role as the analyst for the Family Investment Administration.
Hi, I'm Natalie Andrade, and I'm the analyst for DHS Administration and Child Support Administration.
Okay, I'm going to start on the first chart on the overview of DHS budget. It shows the budget by fund type. In total, DHS allowance in fiscal 26 totals $4.2 billion, which is an increase of $55.1 million or 1.3% from fiscal 2025. As you can see, majority of the budget is made up of federal funds. The largest component, the orange portion of the chart, represents the Federal Supplemental Nutrition Assistance Program. There is a small portion on the top of the chart broken out to show the federal electronic benefit transfers. And the green portion of the chart shows the remaining federal funds. Moving on to the pie chart on page 3, the functional breakdown of the spending. Over half of the DHS allowance funds public assistance payments, which is about $2.2 billion or 53%. The second largest chunk is for personal expenses, which totals about $659.8 million or 16% of the budget. The third largest chunk is for foster care maintenance payments, which totals about $395.6 million. The remainder of the budget funds the administrative and programmatic expenses for the other divisions within DHS. Moving on to page 4 is the higher level overview of the budget for all fund types. The chart also breaks out the funding for federal SNAP and Sunbucks at the bottom. The total funding for these two programs is approximately $1.9 billion, while the remainder of DHS budget totals $2.2 billion. By fund type, general funds in DHS budget totals $1 billion, special funds total $229.7 million, federal funds, excluding SNAP and Sunbucks, total $957.2 million, and reimbursable funds total $33 million. By program, the largest funding goes to Social Services Administration, which is about $791.2 million, and Family Investment, which receives about $706.5 million, and this excludes the SNAP and Sunbucks. Moving on to page 5, we have the breakdown of general funds portion of the budget. The total general funds allowance in fiscal 26 is about $1 billion, which is an increase of $90.1 million or 9.8% from fiscal 25. Accounting for fiscal 24 deficiencies, this difference comes down to $19.3 million or 1.9%. The majority of funds under general funds are dedicated for Social Services Administration and Family Investment. Moving on to page 6, we have the deficiency appropriations for fiscal 25. The fiscal 26 budget proposes deficiency appropriations totaling $200.1 million across the Department of Human Services, including $99.1 million in general funds. The largest fiscal 25 deficiency appropriation replaces $64.3 million in the assistance payments program that was reverted in error during fiscal 24 closeout and is needed to cover fiscal 24 expenditures. Deficiencies totaling $47.3 million are allocated for Social Services Administration, including $38.3 million for foster care shortfalls, in fiscal 25 and $8.1 million for foster care shortfalls in fiscal 24. An additional $30.9 million is provided to the Office of Home Energy Programs for bill assistance and operational shortfalls. Moving on to the proposed budget change chart on page 8. As mentioned earlier, the total budget increases by $55.1 million for DHS. Personal expenses accounts for an increase of $31.9 million. It includes salary increases and associated fringe benefits, including the cost of living adjustment. Program-wise, the Office of Home Energy Program has the largest increase of about $55.9 million, which includes the Strategic Energy Investment Fund for energy assistance. DHS administration's budget increases by about $23 million, which includes funds for MD Think. Budget for Child Support Administration increases by about $5.5 million. Family Investment Administration increases by about $1.1 million, and increase of $7.2 million is for foster care maintenance payment. Under foster care maintenance payment, we also have one-time deficiency related to 24 shortfalls, which is about $8.1 million. There is a decrease of $1.4 million in Social Services Administration. For assistance payments, there is a decrease of about $67.6 million, which is primarily due to one-time deficiency appropriation related to fiscal 24 shortfalls and replacing funds reverted in error. Moving on to page 10, we have the caseload estimates budget assumed in the budget. For the temporary CAS assistance, it is estimated to decrease by 3%. The TCA transitional benefit is assumed to decrease by 23%. The temporary disability assistance payment and foster care adoption subsidized adoption and subsidized guardianship is assumed to remain constant in fiscal 26. SNAP supplemental benefit is assumed to increase by 2% and federal SNAP cases to decrease by 3%. The total collection for child support is assumed to increase by 1%. Moving on to overall personal data in page 11. Overall, there is no change in total number of regular and contractual positions in DHS. The next section, we will be covering the issues. For the first two, I'd like to hand over to Tanya.
Thank you, Chair. The first issue is related to the closeout. You've heard about some of this with the deficiency appropriation. So during the fiscal 24 closeout process, the department made several errors, including reverting funds in error, spending on entitlements greater than the appropriation, and incorrectly reporting expenditures by fund source for both entitlement programs. Exhibit 1 on page 13 shows two things. So it shows for each of the foster care maintenance payments program and assistance payments, the total spending that was reported to the comptroller and that which was reported to the Department of Legislative Services and the Department of Budget and Management in the fall. In both these cases, the total reported expenditures were different than what the department reported to the comptroller. For the assistance payments program, they reported greater expenditures. For the foster care, they reported lower. However, despite the kind of overall higher expenditures reported for assistance payments, for the fund sources other than federal funds, they actually reported lower expenditures than occurred. And for foster care, even though they reported lower overall expenditures, they still over-reported federal funds, and it's unclear why those federal funds were not canceled. Throughout the fall of 2024, DHS was unable to reconcile expenditures reported to the comptroller by benefit program in the assistance payments program, and they were delayed in responding to questions about their closeout, and as of this writing, have not yet responded to some of the questions about their closeout, particularly related to the foster care maintenance payments program. Moving on to page 14, this summarizes some of the general fund closeout issues. So overall, DHS reported lower general fund expenditures to the comptroller in both those programs, a combined shortfall of about $108 million. $90 million of that was in the assistance payments program. That includes the funds reverted in error, as well as $20.5 million of higher expenditures than the available appropriation. That was caused by higher caseload in the TDAP program and a different allocation than what is expected of the federal funds in the temporary cash assistance program. There was about a $18.6 million difference in the foster care maintenance payments program. That program did not have sufficient general fund appropriation. It was the overall cause of that higher than appropriated expenditures appears to be related to the flexible fund spending, and issue 3, which we'll discuss later, appears to provide some of the information on what led to that increase. Aside from the reversion in error, the department reverted about $4.4 million of other general funds from fiscal 2024. Most of that, not quite all of it, would have been available to be transferred to partially offset those shortfalls where they didn't have sufficient appropriation, and it's not clear why that did not happen. And when you have over expenditures, there is a process for reporting those to the comptroller's office, and they did not report those as required. Subsequent to the initial reporting of the expenditures to DLS and DBM, the department indicated that federal funds from the TANF program could be used to cover a portion of the assistance payment shortfall, and that would bring the TANF spending for the TCA program more in line with the original appropriation. They're also being used to cover the foster care shortfall in its entirety through both a deficiency appropriation and kind of restating how they reported their closeout. And the remainder of the shortfalls are covered with those deficiency appropriations that you've already heard about. On page 15, there's a brief discussion of the special funds. They also reported lower expenditures of special funds to the comptroller than what they indicated they had intended to occur. In the assistance payments program, they had sufficient appropriation to cover what they intended to spend, but they transferred a portion of that and also canceled a portion of that even though they were needed to cover their expenditures. The foster care maintenance payments program did not have sufficient appropriation, but if they had revenue to support it, could have processed a budget amendment to do so. Given that they ultimately covered it with federal funds, they appear not to have had revenue to support it. And we've asked the department to comment on their plans to improve their closeout process and reporting the shortfalls to the comptroller is required, and we'll also be making a recommendation in the Family Investment Administration analysis related to the reporting of closeout information. The second issue is about the Temporary Assistance for Needy Families program. This is an annual update that we provide on the balance. So the federal funding is largely unchanged through the block grant since its initiation, and we've received about $228 million since fiscal 2017. The state has also received contingency funds in each year since the Great Recession. They're available to states meeting certain conditions related to unemployment rates or the SNAP caseload. As long as the criteria remains unchanged, the state would be expected to continue to qualify for those. The amount of contingency funds has varied throughout the period of receipt, but has been relatively steady in recent years and has been about $26 million in fiscal 2024. Between fiscal 2021 and 2022, the state replaced $140 million of planned TANF spending with state fiscal recovery funds available from the American Rescue Plan Act. The purpose of this was to help the state with the higher than expected caseloads, but also allow the state to retain TANF balance for future years when general funds were less available. Ultimately, in fiscal 2022 and 2023, though the balance did remain higher than before that fund swap occurred, the department had spent more on the TANF, and so the balance was lower than was expected due to the swap. And the use of the fund balance in those years when general funds were plentiful has reduced the availability of those funds beginning in fiscal 2026 when general funds are less available. Exhibit 2 on page 17 presents information on the TANF balance. As you can see in fiscal 2024, the balance was about $57 million, which was $10 million higher than fiscal 2023, largely due to lower expenditures than expected. I will note that the fiscal 2024 spending reflects some of those restatements of expenditures, so it does not match what would appear in the budget books. The balance, however, is largely drawn down in fiscal 2025 to cover those fiscal 2024 shortfalls as well as fiscal 2025 shortfalls. It covers the assistance payments shortfall in its entirety and also covers about $14.8 million of the $38 million deficiency in the foster care maintenance payments program. Given the decline in the balance, which continues into fiscal 2026, the state will need to realign its spending kind of more in line with the level that they actually receive each year, which will reduce the ability to relieve the general fund of expenditures in those programs. Exhibit 3 on page 19 presents the spending in recent years for the program out of TANF. As you can see, the spending decreases by about $47 million. A lot of that is related to those deficiency appropriations, and then a smaller portion of that is related to some higher spending that was already planned in the foster care maintenance payments program. Exhibit 4 on page 20 presents information on the share of TANF spending that's dedicated to cash assistance. It's historically around 40%, a little over 40%. It was lower in those years when the state intentionally reduced the spending using the stimulus funds, but returned to historical levels after that. Exhibit 5 on page 21 shows the spending of TANF on child welfare purposes. As you can see, the use of TANF on child welfare purposes has grown significantly since fiscal 2020 or since fiscal 2019. The share that is spent on child welfare services has decreased, though, in the last couple of years. However, the spending on foster care maintenance payments remains significantly higher than the pre-fiscal 2020 levels. Of course, 2025 is unusually high given the use to cover the shortfalls and the fiscal 2024 shortfall as well. But even in 2026, when it is reduced, it still remains higher than all of the years prior to fiscal 2020. And with that, I will turn it back to Savichka.
The third issue is on the number of children in out-of-home care placed in hotels. Exhibit 6 on page 23 displays the number of children in foster care that are placed in hotels in fiscal 23, 24, and year-to-date fiscal 25. 154 children were placed in hotels in fiscal 23 and 180 children in fiscal 24. DHS reports that fiscal 23 numbers might not account for all of the children placed in hotels due to absence of a formal data collection process. This is reflected in the increase in the number of children placed in hotels from fiscal 23 to 24 following the implementation of formal data collection process. Moving on to Exhibit 7 on page 24, this shows the average length of stay of children placed in hotels. The average length of stay has been following a decreasing trend line from fiscal 23 to fiscal 25. Exhibit 8 on page 25 shows the expenditure categories for children placed in hotels. As you can see, all these categories have been increasing, specifically for flex funds. The flex fund has increased drastically in the last 2 years. While improved reporting may account for some of the increase in the number of children placed in hotels, the increase in spending indicates the number of children placed in hotels might be increasing. DHS should discuss the situations in which children are placed in hotels and efforts made by the department to reduce placements in hotels. DLS recommends adding a language to fiscal 26 budget bill. This will appear in DHS Social Services Administration analysis. Moving on to the fourth issue on page 26. During fiscal 24 closeout process, DHS provided delayed response and was unresponsive to certain requests from DLS. In addition to that, DHS has also delayed in submitting responses to report requests contained in Joint Chairman's report, as shown in Exhibit 9 on page 26 and 27. Out of the 18 reports requested, only one was submitted by the due date. As of January 18, 2025, 4 reports are outstanding. DHS should comment on the measures that it is taking to improve the timeliness of submissions of reports and other requested information. And with that, we conclude our presentation and we'll take any questions you may have.
Thank you so much to our DLS analysts for this thorough review and for your work in advance. Really appreciate it. Questions from the subcommittee? Okay, seeing none, thank you so much. Now we'll call up Principal Deputy Secretary Carnitra White, as well as, thank you, the Acting CFO, Jessica Smith, and anyone else you wish to bring to the table, ma'am, to join you. And you can begin when you're ready. Thank you for joining and welcome back to HSS. I know this is the first of many conversations we'll have.
Good afternoon, Chair Shetty. Yes, this is the first of many conversations we'll have this year, but it's a pleasure to be here before you. Can you guys hear me? Come closer? Okay. Better? All right. I'll use my outside voice. Is that better? All right, excellent. So good afternoon. This is the first of many conversations we'll have. So good afternoon, Chair Shetty and members of the subcommittee. For the record, I'm Carnitra White, and I serve as the Principal Deputy Secretary for the Department of Human Services. And with me is our Acting CFO, Jessica Smith. And we also have members of our leadership team and our local director from Anne Arundel County, Rachel McConaughey, in the audience. We'd like to thank Governor Moore, Lieutenant Governor Miller, and our colleagues at the Department of Budget and Management, the budget committees for their support. We're grateful to our analysts. Oh, let's see where you guys went. To our analysts for the budget analysis. We at DHR are honored to serve more than 1 million Marylanders. We serve to ensure that every Marylander can reach their full potential by providing preventive and supportive services, economic assistance, and meaningful connections to employment development opportunities. Our team consists of nearly 6,000 employees across the state in our 24 local departments of social services, which administer 80% of all of our activities in our $4.2 billion budget, of which 69% is federally funded. To do this work, we must deploy these resources strategically. And to do this work well, we must hold ourselves accountable to a high standard of excellence in customer service. We acknowledge that we continue to face major challenges in our efforts to modernize our department. We continue to discover deeply embedded issues such as fragmented data reporting approaches with manual or outdated processes. To meet these challenges, we continue to invest in our people, our policies, and our practices. Over the past year, we have conducted a systematic rebuilding of our teams and functions, including a particular focus on our budget and finance department. For example, for the first time in 2024, we were able to load our detailed financial data into the financial management information system. This allowed us to manage according to our budget and track spending. Prior to FY25, DHS did not utilize the detailed allocations in FEMAS. We have continued our efforts to rebuild state government in a responsive and sustainable way. On December 31st, our vacancy rate was 7.97%. a decrease of 7.23% from January 1st, 2023, when we had a vacancy rate of 15.2%. Now I'd like to share a few highlights of our work and plans for this year, and then we'll respond to the issues raised in the analysis. This past summer, we launched our Maryland Sunbucks program. This would not have been possible without your support, so I want to thank you for the partnership that we had with you regarding this program. In summer 2024, we distributed $120 in direct benefits to every eligible child across the state, making it the largest investment in Maryland's history to address summer hunger. We innovatively and seamlessly implemented a new Sunbucks program to help families achieve greater nutrition access and equality. It took 52 days from when the legislation was signed into law to when meals funded by this program were on the kitchen tables across the state. This summer, the new Sunbucks program served over 594,000 children across the state of Maryland in all 24 jurisdictions. This represents a 6.5-fold increase from the previous year. This is something that I think we all can celebrate and be very, very proud of in the state of Maryland. This was a significant undertaking, and it was successful because of the unprecedented cooperation across state governments, including our partners with the Department of Education, Health, and the Health Benefits Exchange. It's a clear example of how, when we work together, we can achieve enduring results for the people that we serve. And I'm pleased to share that we will maintain this program in 2025, and we'll discuss more about the program in our Family and Investment Administration budget hearing. Next, I want to talk about something I think we all can relate to: family. Last year, with your partnership, Senate Bill 708, Kinship Care, was enacted. The Kinship Care law prioritizes kin placements, broadens definition of kin to include family members, close friends, and those connected through cultural or tribal ties. Research shows that children who are placed with family members are more likely to maintain their relationship with siblings, experience fewer placement disruptions, and show better mental health outcomes. The connection to family, community, and culture is vital to the child's development. In essence, family matters. Family matters is not just a policy shift, it is a cultural shift, a shift that centers family and community in the lives of our children. Today, only 27% of the children in Maryland's foster care system are placed with kin. We can and will do better. We will partner with family members to prioritize kinship for youth, support kinship caregivers, and strengthen lifelong bonds. Together, we will ensure that children in Maryland grow up with the support they need to thrive. The next initiative I'd like to talk a little bit about is something that we just launched in December, and it's our Unified Benefits Screener. We partnered with our colleagues at the Department of Innovation and Technology and the Department of Health to announce the launch of the Unified Benefits Screener in December. This is a tool on MyMD and it enables Marylanders to determine their eligibility for critical support programs in just minutes. As of July 23rd, 2025, the Benefits Screener already helped Marylanders complete 42,865 checks with an average time of completion of the screener at 4 minutes and 41 seconds. I don't know if any of you have ever been on MyMD, but that's a big accomplishment. The Benefits Screener helps Marylanders quickly and easily check their eligibility for Medicaid, Supplemental Nutrition Assistance Program, SNAP, the Energy Assistance, WIC, Temporary Cash Assistance, and the Home Energy Assistance Program. In 2025, we will take the next step of launching a common application to increase benefit access. Building on the benefit screener, the common application will enable Marylanders to apply for multiple benefits with a single online form. The enhanced technology will simplify benefit applications, making it easier for Marylanders to access, apply for, and manage their benefits. Too often, we ask persons to prove their poverty over and over again. This work will represent a critical step in meeting Marylanders' needs in a way that is simple, seamless, and swift. Now I'll turn it over to our acting Chief Financial Officer, Jessica Smith, to briefly summarize our response to the first item from the analysts.
Thank you. Good afternoon, Chair Shetty and subcommittee members. In response to the first item, I will share the actions we have already taken and our plans to improve our closeout processes and financial reporting. We acknowledge our accounting errors and have taken immediate course corrective actions to improve our fiscal year 2025 closeout process, including making key changes to the fiscal leadership team. Over the past 18 months, we have continued the systemic rebuilding of the DHS finances to include rebuilding and/or creating fiscal processes and invoice payment systems, realigning our top-line budgeting process to be program-specific and FEMA-centered so we have true quarterly performance measures, developing more accountable systems to maximize federal fund drawdowns, and implementing quarterly expenditure monitoring with the local departments of social services and central administration programmatic units. What we have found is that many standard operating procedures simply do not exist within DHS. And while maintaining auditors' independence, we have worked in partnership with the Office of Legislative Audits and problem-solved in real time to address or begin to develop the corrective actions for these issues. We have been proactive in communicating our budgeting challenges with the Department of Budget and Management. And beginning in 2023, and with DBM support and technical assistance, we have made major changes in our Office of Budget and Finance and will continue to do so at every level. Now I'll turn it back to our Principal Deputy Secretary, Carnisha White, to respond to the other matters in the DLS analysis.
Thank you, Jessica. The second item was regarding the situation in which children are placed in hotels and our efforts and the efforts that we've been making to reduce the stays in hotels. We concur with the addition of reporting on hotel stays for children experiencing out-of-home placements and will provide the requested information. And let me just stay on the record that hotel is never an acceptable setting for any child to live in. Many of you know I used to be the local director at Anne Arundel County Department of Social Services, and making a decision that to have a child stay in a hotel is not one that's taken lightly. And it's not one when we have a child in a hotel that, as a local director, you sleep well at night. So it's never an acceptable setting for a child to live. But if circumstances demand that the state must intervene on behalf of youth, we try to prioritize reunification or living with kin, as I talked about, because family matters, because or youth in other placement settings. In addition, we've made use of our rate reform, our provider quality assurance work in the fall of 2024 to help us hold each other accountable so that we can maximize the challenges that youth in Maryland are in the least restrictive and most clinically appropriate settings. We have adopted a practice of limiting the use of temporary stays. I want to offer a little bit more detail on that. In 2024, our Executive Director of the Social Services Administration began to facilitate case staffings between our local departments and the central office to understand the challenges and the barriers for youth in hotel stays and to action step to secure appropriate placements. We've worked with the local departments to ensure accurate data is captured, because without knowing the magnitude of the problem, then we can't begin to appropriate correct solutions. With rate reform launched in October 2024, the department issued clear expectations to our residential child care providers to ensure timely response to placement referrals so that Maryland youth can remain in the state, and we've been encouraging providers to develop innovative solutions so that we might get to yes for placement. We are finalizing a new policy that will require additional notifications and updates to the Office of the Secretary and to our Social Services Administration from our local departments. We'll hold weekly staffings and to ensure urgent action is being taken to move the youth to an appropriate setting. As of January 27, 2025, Out of the 303,689 youth in state's care, 28 are in hotels, 28 too many. But that's less than 1% of all of our youth in care. For comparison, a year ago, February 16, 2024, there were 54 youth in hotels. So you'll see that we have some progress that we're making there. Still a long way to go. We will use every tool at our disposal to continue working towards ensuring no child experiences a hotel stay. Next, the next issue was regarding the timeliness of submission of reports and other requested information. First, I'll apologize for the delayed reports. We've made a consecrated effort to ensure our data reporting to you has confidence and reflects our high standards of integrity. Over the last year, we've renewed our focus on ensuring that any public-facing data is consistent, validated, and comprehensive. I read most of these reports, and sometimes I have lots of questions about the data and challenge the data. And so in our data review, we found that we had inherited antiquated and manual data creation and reporting processes that we just didn't have confidence in. As we uncovered these challenges, we immediately began to rebuild our approaches to reporting out our data. Addressing these unexpected data-related challenges while preparing reports or summary statistical analysis can take our team extra time, which therefore leads to the delayed submission. We have prioritized improving data integrity and validating practices that we have inherited. As a result, we developed the data office. The office is designed to modernize the agency's data collection and public reporting across various programs and divisions. We brought in new leadership across all of our administrations and hired key program staff that will allow us to consistently and accurately prepare reports with publication and for our publications. With that, I thank you for your time, and we look forward to answering any questions that you may have.
Thank you so much to our DHS team for your thoughtful responses. We'll turn to members of the subcommittee for questions now. Who would like to start? Madam Vice Chair.
So first, let me start off. I too don't have the microphone close enough. There we go. Thank you so much for all that you do. It's incredibly hard work, and so many depend on you. So many depend on you. Sunbucks, congratulations on a successful summer. I know that this subcommittee, I won't speak for everyone, but we are so incredibly proud of that program.
Thank you. Thank you for your support.
Absolutely. So the last week, this week, it's still the same week. It's still the same week. Time is a flat circle, but it's been a painful one. Instability, chaos. I know that's what so many felt, and I think that it was by design, personally, and I worry about the foreshadowing, right? That this, so let's dig down on the federal government. DHS response says that 69% of the agency's budget is from federal funds. Given the uncertainty created by the Trump administration and their announced pause, and they rescinded the pause, then only some of it came, to federal funding, can you share any updates on what you know and how it might impact Marylanders who receive it?
So I can say that we have been able to draw down money this week, so that's the good news.
Great news.
That we start with. But like you, we continue to wait the final guidance from our federal government so that we can more accurately determine the broader impact of the conflicting directives that we've received. We use the same payment management services website as the Department of Health, so some of our federal, for some of our federal programs. So we are particularly monitoring any impact on our SNAP program, as well as our TANF program, and other federal programs. We know that We have some mandated programs. So there are some programs that are mandated, but then we also have many discretionary programs. Our refugee assistance program is a discretionary program, and we are concerned that will have that seems to have a direct impact by the OMB guidance. And then we don't know what impact our TANF program will have at this time. That's about $93 million, and the refugee assistance program is $100 million. And then we have some discretionary programs as well in our child welfare program to include our Title IV-B, our CAPTA, Kinship Navigators, and our Chafee dollars. And then in child support, we have some child support matching grants that are also, that's part of a mandated program, so we should be good there. But we don't know about the home energy assistance program, the adult guardianship program, or the community service block grant. So we're waiting for further guidance. Like I said, right now, this week, we have been able to draw down dollars, and we have already mapped out those dollars, and we will continue to monitor this as we get more information and work with our state partners around contingency planning.
Well, thank you so much for that answer, and especially with the contingency plan and planning for. So Maryland annually receives $228 million from federal TANF. The TANF block grant, which funds support for cash assistance, and you spoke a little bit about this, but I just kind of wanted to drill down. To support for cash assistance to most vulnerable families. The DLS analysis notes that Maryland is anticipating receipt of the same funds for FY26, which potentially are the assumptions made by the governor's calculations for FY26. In his FY26 budget, what happens to the program if it's unraveled at the federal level?
So our TANF programs, we pay part of our cash assistance out of that program. We use some of our cash assistance. So there will be impact. If it's unraveled, there will be impact on Marylanders, particularly around economic benefits.
Thank you so much.
It's really scary to hear, but important for us to be thinking about these impacts. Thank you, Vice Chair, for pointing them out. Thank you, Madam Principal Deputy Secretary. Sorry, it's I keep tongue-tying over.
My mom calls me Carnitra, so.
I know, but we got to be formal here, ma'am. So, but I appreciate you and all the work that you're doing. Delegate Acevedo.
Yes, thank you, Madam Chair. I just have a quick question. I know your department agency deals with instances of abuse, children as well as adults. Does that include seniors, senior abuse, et cetera, or is that the Department of Aging? I'm just trying to understand.
So we are mandated to investigate any abuse of adults 18 or over. So it doesn't matter. We are the mandated investigative department.
Got it. Appreciate that. The reason why I'm asking is because there's, and this was a question that I asked of the Department of Aging some time ago when I saw the numbers, but the name of the organization is slipping me right now, but it's an organization that essentially works with LGBTQ plus seniors, and they also compile complaints that they receive around elder abuse, senior abuse, et cetera. SAGE, that is it, right? So SAGE works specifically with the LGBTQ senior population. And what I noticed that there was an increase in terms of complaints around abuse, misgendering, to treatment of LGBTQ seniors here in Maryland. I'm just curious if your department is aware of, or do you all handle cases such as that? And is that something that you all have been addressing these past couple of years? I asked the Department of Aging, but yes, if you could just respond to that, I'd appreciate it.
So I don't have that specific information on hand, Delegate, but I can follow up and get that back to you.
I'd appreciate that.
Yes,
Thank
sir.
you.
Thank you so much, Delegate, and thank you for the response, Department. Delegate Heinbach.
Thank you, Madam Chair. Thank you for your response to the DLS analysis. It's very interesting. You deal with obviously a lot of very important issues. I have a pretty simple question here. It's on page 5 of the DLS report under the budget overview, general funds. It looks like there's a $11.8 million increase in program administration of the social services administration budget. Can you tell us what that's attributable to or what that'll be used for?
Give me 1 second. I can look into that for you. I do know that we received an increase to implement our foster care maintenance program as a response from DBM. They increased our general fund component for that program itself.
Okay.
So I believe it's based on the projections of foster care maintenance.
Yes.
Thank you so much. Other questions from subcommittee? Delegate McCaskill, are you reaching for your microphone?
I apologize.
My bad. All right, go ahead.
Now, unless you all just don't want me to say anything, cut it off. Okay, thank you, Madam Chair. Happy New Year.
Happy New Year.
Good to see you all.
You as well.
So I am going to concentrate on the closeout concerns. I'm looking at page 13, Exhibit 1, and then I'll refer to page 15 as well. You all are there, perfect. So my concerns, and maybe you can give me more information around this. My concerns is that from the DLS analysis that it says DHS has also not provided sufficient information to fully describe the reason for the higher than expected expenditures or new fund source reported in the foster care maintenance payments program. And so I'm just curious, can you just provide me more information with that, with those expenditures?
Sure. And so as we stated earlier when we began giving our response to the analysis, a lot of the processes that we do in the Office of Budget and Finance is a manual process. As such, when we go back and look at our caseload that is housed in a separate system, there are often times where there are new initiatives that are implemented. And so when we go in to do the calculations at closeout is when we are notified of these increases in these sources, these source funds. And so as it turned out for fiscal year 2024 closeout, there was a fund source that was implemented prior to the current staffing that we had at that time was made aware of. And so we had to do some research to do so to report that fund source as well as the increase in the caseloads that we reported in our foster care maintenance. As such, I have been speaking with our comptroller's office with GAD, and we have provided that information to them concerning our closeout for the foster care maintenance program.
Okay, perfect. I did hear you mention earlier about making changes to your team and operational changes, so hopefully that'll help you all as well. I want to refer over to page 15 of the analysis notes about the assistance payment program. So DHS has sufficient appropriations to cover expenditures, but transferred, and I believe it's $6.2 million to other programs and canceled $534,000 plus from within its remaining special fund appropriation. Can you share any information about why that occurred?
Sure. And so within our local Department of Social Services, they are also running and administering some of the same programs that are funded from the special fund source. And as such, if the funding or the expenditures are located in the local Department of Social Services, by law and in the budget language, it is giving us the instructions that we are allowed to transfer the appropriation for the use as long as it's within the realms of the activity that it is specified for. And so that's what we took advantage of doing in our 2024 closeout. And as such, the cancellation is a result of the remaining balance from the assistance payment program itself.
Okay, perfect. Thank you.
Sure,
Thank you for explaining that. Thank you, Madam Chair.
Thank you, Delegate. Thank you to the DHS team for response. Delegate Ruff.
Thank you, Madam Chair. And thank you, Deputy Secretary and Ms. Smith. Thank you so much. I wanted to touch base on the deficiency appropriations. I know, thank you for kind of prefacing everything with, the change in the processes and the realignment of the budgeting process, having this more accountable systems that you guys are implementing, and the quarterly monitoring. So I heard that loud and clear, and I think it would be helpful to all of us if you could give us more detail, especially as it pertains to the $64.3 million, error and reversion. It could be helpful if we could have more detail on how you're addressing that, how we got here, and especially with these changes that you've lined up, can you just give us more detail on what measures DHS is taking to ensure that such a significant mistake does not occur again? Just give us more color on the specific steps that are being taken in each one of these areas that you've highlighted.
Sure, no problem. How we got here in FY 2024, the closeout, again, because we are operating with outside systems versus the assigned state financial management information system, we had some entries that took place that were outside of the scope and the realm of our normal practices, which caused us to leave general fund money on the table. And our partner at the comptroller automatically then reverts or close out that balance. And as such, we recognized that realized that we did need those funds. And so we had to make the recommendation to our DBM partners to request that money to come back to us for those initiatives. And to make sure that we're not doing and following the same processes, we have implemented a process every quarter in which we review all of our activity to ensure that we're properly accounting them, not only in the external systems, but also utilizing the state financial management system on a quarterly basis to ensure that we're posting and that we're recording all of the activity in the correct funding streams according to the services that we are providing to the Marylanders.
Okay. And to get more specific into the deficiencies, I looked at page 6 of the analysis. Could you tell us a little more about those appropriations outlined for the SNAP senior supplement, the revised estimate for SNAP EBT fraud, and the revised estimate for cash assistance EBT fraud reimbursement?
And so, just speaking frankly, the EBT fraud and SNAP EBT fraud, those deficiency reimbursements are due to our federal partners and rearranging the federal amount that we receive for paying for these services. And as such, DBM, in relation with our Family Investment Administration, has taken a look into how we can continue to provide these services and what other funding streams that we're going to utilize to be able to do so. And so if you need more detailed information, we can provide that to you at a later date.
Perfect.
No problem.
And then the last question, Madam Chair, if I may. So moving to the the OHEP, the budget proposal allocates an additional $30.9 million for OHEP to address bill assistance and operational shortfalls. Can you provide more clarity on why those shortfalls exist, especially as it pertains to operational needs?
Sure. Historically, our predecessors would not ask for the increase to spend the federal funding that we were receiving. And as such, we would typically have a situation where we weren't able to provide additional assistance to our Marylanders. And as such, this year, we are trying to and currently implementing a process now where our federal funding is in alignment to the appropriation that we received. And as such, we had to ask for additional appropriation so that we can continue to spend the additional federal grant money that we have received. And then again, to be able to provide bill assistance to our Marylanders in accordance to what they ask for.
Very good. Well, I look forward to the follow-up and this increased improvement to the management.
Thank you.
Thank you.
Thank you so much, Delegate. Thank you, Department. Delegate Acevedo.
Thank you, Madam Chair. Just one quick question. I was going to also ask this earlier. I know last year there was a case with Department of Human Services around TCA, temporary cash assistance, and people with disabilities. I believe this was last year. The department, among other things, had agreed that there would be some regulatory overhaul, et cetera, and whatnot. Can you all provide an update as to where the department is on TCA as it relates to people with disabilities who are applying for benefits? I believe this was last year. I think, what was it, the Homeless Representations Project had brought a case of discrimination. I believe it was last year. Happy to follow up offline, but it was something that was brought to my attention. I'm curious to know just what the department's response has been since then.
Yeah, can we follow up offline
Absolutely.
so we can make sure that we're addressing the correct issue?
Sure thing. I'd appreciate that. Thank you.
Thank you, Delegate. Thank you, Department. Did you have a second bite? Okay. Yes, Madam Vice Chair.
Thank you so much, Chairwoman. I apologize. You did also address data and data reporting, which was something, so thank you for addressing that. That were other questions I had. But on page 26, the DLS report highlights as of January 18th, 2025, there are 4 reports outstanding. Do you have any updated timeline for when the remaining reports will be received?
I can get that to you.
Okay, great.
Yeah, I definitely will get that to you.
Thank you so much, and thank you, Chairwoman.
Thank you, Madam Vice Chair. Okay, thank you for sending an email to all of us on that updated timeline. I have a couple questions, if you don't mind. So I'm going to follow up by email with the details here, but I see that there is noted on page 5 in the Programs and Administration budget, there's a significant increase in the Office of the Secretary, Information Management, and a couple of other areas too. That accounts for about a 9.9% increase in the over FY25 spending. So I'd like to, my staff will follow up with you by email to ask for some details on that, and we will copy our DLS analysts as well. And I want to get to 2 subjects that I want to talk about. So first is on child support. So on page 10 of the analysis, there's an estimated increase of 10% for TCA collections on child support. Can you just remind the committee, please, what this line item means and share why you are forecasting a 10% increase, which accounts for $17 million of the budget?
So TCA collections for child support is the reimbursement of us from the child support. When persons pay child support and are on TCA, then we are able to get reimbursement from some of that child support dollars, and we have a pass-through for our customers as well. So there is a $100 pass-through, and so we can follow up on the projections, but I think it's just the projection of the caseload and the amount of collections that we anticipate.
Understood. Okay, thank you. Yes, I would appreciate a follow-up on that, but grateful for the reminder of what that portion of that budget is. On foster care, page 23 of the analysis notes that the number of foster children placed in hotels, it's a table of 23 through year to date per jurisdiction. So I really appreciate all of the department's efforts to ensure that no child is hoteling. And I understand the deep personal commitment that you have, Ms. White, in particular, given your long history working on these very challenging cases. So I'm wondering if you can share any information about why there are such large disparities in some of the counties. So specifically, I note that Baltimore County has had, over that time period, 116 children, and they are by far the highest. The second highest is Prince George's County at 52 children in the same time period. Do you know any reasoning for why we're seeing such huge disparities in the jurisdictions?
So some of it is also the caseload. So they're also our largest local departments with the number of children in out-of-home care outside of Baltimore City. So some of it, you have to balance it against the number of children that are in out-of-home care. And then some of it is just case practice that we're working on.
Understood. Okay, thank you. I really appreciate understanding that. And I also note that the DLS analysis notes that the numbers for 2023 might not account for all the children placed due to the absence of formal data collection processes. Has that been remedied? Do we know where these kids are now?
So it's all of children who experience hotel stays at that time.
Okay.
We weren't, when we came into office, we began counting, and so that would have been half of the fiscal year. So that we just wanted to footnote that these may not be the complete accurate numbers.
For that year.
For that year.
But then going after that, the department has prioritized collecting accurate data.
Correct.
It sounds like. Great. Okay. So related, I know you and I and many others have been working really hard on the pediatric overstay status challenge in our hospitals. This is not part of our budget discussion, but it's very much related to this work, given that about 75% of youth that are in pediatric overstays in hospitals are also in the foster care program. So I want to make sure, I know you and I have been part of many small group discussions on this, but are you, can you just speak to your ability to track the numbers of young people that are in this status? And are you working with MDH hospitals and others towards remedying this challenge?
Yes, Chair. We currently, and this was as of 1/29, we had 15 youth in hospital overstays. So we track this religiously. I can tell you the counties that those children are who are experiencing overstays as well. We work directly with those local departments of social services from the time the child is entered into the hospital on discharge planning. We work with the hospital. We have assigned a hospital liaison who is in constant communication with the hospitals as well as with our local departments. We continuously staff those cases until we can find appropriate placements. We try to use innovative practices in order to get to yes. Sometimes we don't have the resources in our state, so children are going out of state, and that sometimes takes time because we have to do a procurement process and a contract with that. But we are working to make sure that we're keeping everyone up to date and working in partnership to resolve this issue.
Thank you so much for your incredibly important work on this and all of the issues that you all work on. Thank you. Are there final questions from our subcommittee? Okay, thank you again. I know this is the beginning of many conversations, and it's wonderful to have you here. Welcome to the acting CFO. I'm excited to work with you as well and get all of the data that we need for these processes. Thank you so much. Our budget hearings for today are concluded. Thank you.
Thank you. Good job, Jessica.